Hello friends. Now in the previous sessions we have discussed about the different types of entries of toxic chemicals in your body, and that is why we must know the type of exposure, we must know the maximum permissible limits which is guided by the State Pollution Control Board as well as some of the medical agencies, and what exactly the effect of this particular chemical on our body. And for that purpose, the type of exposures and the permissible limits are very important. So this may be brief or prolonged. Individual susceptibility to exposure depends on age, sex, pregnancy, smoking, alcohol intake, and general state of health. So if your age is different one, if you are male or female, depending on that also, if you are smoker or non-smoker, or if you are taking alcohol on a regular basis or on a particular frequency, or what exactly the state of your health is. So depending on the different parameters, this type of exposure is decided. So the permissible and threshold limit of exposure and doses are decided by the different agencies, but mainly when you observe, these threshold limits are decided by the Americans again. So one of the limit is PEL, that is called as permissible exposure limits. So under the OSHA 29 CFR, it is clearly mentioned what exactly the PEL is. It is permissible exposure limits. Means it is nothing but a maximum permissible exposure limit for that particular toxic chemicals which can be inhaled, which can be deposited in your body for that particular limit only. If that limit is exceeded, then we have to go for a particular treatment which is guided by that medical experts. Specifies the maximum amount or concentration of chemical to which worker may be exposed. So generally it is defined in three different ways. So PL can be defined in selling limit, it can be defined in STEL, it can be defined in TWA. So selling limit, it is denoted by capital C, that is nothing but the concentration that must not be exceeded at any part of the workday. So normally we are working for 8 hours in industry, so the maximum concentration that must not be exceeded is called as selling limit for that particular chemical. The second one is STEL value, that is called as short term exposure limit, that is for the 15 minutes. So it is the maximum concentration to which workers may be exposed for a short duration of time, that is 15 minutes. Then TWA, that is time weighted average. So it is the average concentration for 8 hours, that is for working. So a average concentration to which workers may exposed for a normal 8 hours a work day is called as TWA limits. So all these limits, that is maximum permissible limits, may be given in terms of C, maybe in STEL, in terms of DWA. So we must understand what exactly these C, STEL and TWA limits are. Then the other exposure limits are TLV, that is in terms of threshold limit values. So this is one of the important type of exposure, and it is prepared by the American systems, that is ACGH volunteer scientist. So this denotes the level of exposure that nearly all workers can experience without an unreasonable risk of disease or injury. An advisory limit not enforceable by law generally can be defined as a selling limit, STEL limit, TWA limit, usually equivalent to PLs, etc. So this is not mandatory or essential condition when we are talking about the legal requirements, etc. But these are the main guidelines which is given by the ACGH rules. So it is the legal requirement when we are talking about the TLV, and the reference is the Factory Act 1948 under section 41F second schedule. So TLV-TWA is clearly mentioned in this Factory Act. So TLV means threshold limit value and TWS means time weighted average. So when we are talking about the time weighted average, so they are going to consider the 8 hours working day or 5 days in a week. It means 8 hours into 5 days, that is 40 hours working week. So for that 40 hours per week, or for that 8 hours in a day, this TLV TWA is referred. If you are talking about the short term exposure limit, so that is for 15 minutes only. So the maximum concentration for 15 minutes, especially when we are talking about the suffering from irritation, chronic irreversible tissues change, or necrosis, provided that no more than 4 times per day. It means you can go for doing this type of work, which is clearly mentioned under TLV-STEL limits. So you can use these 15 minutes criteria limit for 4 times in a day. That is maximum for 60 minutes, but with some gaps. Then depending on the conditions, for example, limits for ammonia is 25 ppm and 35 ppm, and for chlorine 1 ppm and for 3 ppm respectively. So if you are working in a ammonia atmosphere, then TLV-TWA limits are different and TLV-STEL values are different. So if you are going to use the maximum concentration but with less time, less than 15 minutes, then you can go for the TLV-STEL value. If you are working for more than 15 minutes and less than 8 hours but with less concentration, then you can adopt the TLV-TWA limits. Then the other limits are REL, that is recommended exposure limits, which is recommended by the NIOSH and indicates the concentration of substance to which a worker can be exposed for up to a 10-hour workday during a 40-hour work week without adverse effects. However, sometimes based on the technical feasibility. So we have to check first compatibility, technical feasibility, and then only we can go for this 10-hour workday criteria, which is recommended by the NIOSH. It is called as REL limits. So based on the animal and human studies, we can use these ceiling limits, short-term exposure limits, or time-weighted average limits as a PL. Then there is another limit that is called as WEEL, that is workplace environmental exposure limits. So it is developed by IDLH volunteers, which is focusing on the industrial hygiene itself, and this is advisory limits not enforced by the law, typically developed for the chemicals that are not widely used for which little toxicity information is available. So the chemicals which are having very less information regarding the toxicity is concerned, for that chemicals only these WEEL limits are concerned. Then there is another limit that is called as company developed limits. So some of the companies are going to prepare their own standard, prepare their own maximum permissible limits or permissible exposure limits, and that is why it is called as company developed limits. So it is developed by the company scientist, advisory limits, and it is not forcible by the laws, usually based on the short-term studies of animals and generally intended for the internal company use, and sometimes for the customers TLV may differ in different countries as shown below. So the TLV may be different for different countries depending on the conditions and the use of that particular chemicals. Like aniline, the TLV in India is 2 ppm, but TLV in Sweden is 1 ppm only. So Sweden is going to follow the stringent norms because 1 ppm is the maximum limit for aniline, but India here 2 ppm. Likewise, you can observe the benzene 10 ppm in India and 5 ppm in Sweden. Oil mist 5 mg per meter cube in India and 3 mg per meter cube in Sweden. Trichloroethylene 50 ppm and in Sweden 20 ppm. Vinyl chloride 5 ppm in India and 1 ppm in Sweden. So company based or company developed limits can be changed in different countries depending on the exposure of that chemicals. Then there is another terminology in this type of exposure is IDLH, which is called as immediately dangerous to life. That is also called as IDLH in short. Concentration immediately dangerous to life or health from which a worker could escape without any escape impairing symptoms or any irreversible health effects from NIOSH or OSHA guidelines. It is a concentration at which a person can escape without the use of respirator within 30 minutes. So this is used as a selecting type of respirators. So there are some chemicals which are very much toxic or dangerous or poisonous, and that is why for these chemicals IDLH value is very important. So from that working environment, it is clearly guided from the NIOSH and OSHA that you have to escape that particular environment within the 30 minutes for that particular maximum permissible value, and these values nothing but IDLH, that is immediately dangerous to life and health. Then there is another limits, that is tentative biological exposure limits or health based limits. So from the title itself you can understand, depending on the biological hazards, depending on the adverse effects on the human organisms and health effects, these limits are decided. So in fact the human organism itself may be regarded as a kind of sampling services. A worker's body represents his own individual collector, register and monitor for his personal exposure. To arrive at an accurate evaluation of toxic exposure aspects, many additional physiological data are nevertheless required, such as rate of inhalation, quantity of inhaled air, percentage of absorption by the skin and by the intestinal tract, retention rate of metabolism and excretion, etc. So depending on the condition, depending on the health, normally the doctors are always test first the oxygen level, then the heart or the pulse rate. Then if they are not satisfied, then they can go for the different test. That may be a urine test, that may be a blood test, or that may be an X-ray test. So depending on this test and analysis, they can understand what exactly the chemicals are contaminated in that body. So that is called as biological exposure and biological monitoring. So depending on the biological hazard which is present in that industry, we must go for the frequent medical examination for this biological exposure, and the limits are considered for that industries only. Then WHO is also going to guide regarding these bacteria, viruses or fungus which can be present in the working environment in the industries. Then this is one of the important terminology as far as the chemicals, toxic chemicals are concerned. That is LC or LD. So LC means lethal concentration or LD means lethal dose. So the meaning of this LC or LD is one and the same, but depending on the state of that chemicals, that terminology can be used for that maximum permissible limits. So in experimental toxicology, it is a common practice to determine the quantity of poison per unit of body weight of an experimental animal which will have a fatal effect. So normally what exactly the scientists are doing in various institutes, they are doing the experiments for the fatal effect. That is, they are literally going to kill the rats or the animals or sometimes the frogs by injecting a particular dose of that chemicals, or by making a particular environment with some of the toxic chemicals. So suppose they are injecting some of the toxic chemicals in that body, and out of 10 rabbits, if the 5 rabbits are killed due to that dose, then it is called as lethal dose value, lethal dose 50 value. What does it mean? Lethal means kill or fatal or death, and there are 50% chances of death due to this dose. That is why it is called as LD50. Right? So 50% chances of death due to that dose. If the 100% chances of death due to that dose, then it is called as LD100 value. If there are 10% chances, then it is called as LD10 value. If there are no chances of fatality, then it is called as LD0 value. But generally, when we are discussing about these LD values, so the common LD50 parameter or terminology is famous. It means there are 50% chances of death due to this dose of that particular chemical. So this is called as LD or LC values. So when we are talking about the solids or liquids, normally we are using the LD value, and when we are talking about the gases or vapors, then we must adopt the LC value. The meaning of the LD or LC are one and the same, whether it is in solid or liquid state or whether it is in gases or vapor state. Depending on that only, we are using this LD and LC terminologies. So this is different examples of different chemicals and the characteristics of that chemicals, like chlorine, then some chlorine gases, chlorine solids and chlorine liquids. So there are different values of this LC50 or LD50 or LC0, LC10 values likewise. So other terms like lowest published toxic concentration, that is TCL0, toxic dose level TDL, and lowest published toxic dose TDL0. So these values are also used, but the famous and commonest example is LD50 value. So these are some of the examples, that is extremely toxic, highly toxic and toxic categories chemicals. Oral, if these chemicals are ingested to your body through the mouth, that is called as oral toxicity. So if it is less than 5 mg per kg, then it is extremely toxic. If it is 5 to 50, then it is highly toxic. If it is more than 50 but up to 200, then it is called as toxic chemicals, and it is through oral. Likewise, if the chemicals are through skin, then it is dermal LD50 values, and if it is through the respiratory system, then it is inhalation LC50 values. So depending on the routes of entry of these chemicals and depending on the values, we can categorize these chemicals as a extremely toxic chemical, highly toxic chemicals, or toxic chemicals. And some of the chemicals are calcium cyanide, chlorine, ammonia, diethyl, etc. Say for example, this is the 39 mg per kg is the oral rat value for the calcium cyanides. Means for 1 kg rat, 39 milligram calcium cyanide is sufficient to kill that rat, and the chances of killing that rat is 50%. So likewise you can understand the meaning of these different values. Thank you.